I feel low back pain is something that so many of us have experienced or will experience in the world we're in, because we have so many things in the world we're in that pull us out of alignment: chairs, phones, devices, stress, tension, fear, sitting. It all creates a misaligned body where our cells are being pushed and pulled out of their place, along with our joints and our organs, and our whole structure is living in this misaligned position. Now, when we do things in our day, we tend to spend a certain amount of hours doing whatever it is that we do. So if we tend to sit a lot in a chair, for 8 hours a day, we're practicing being in like a closed position, meaning that our psoas muscle connecting our lower body to our upper body is becoming really tight and constricted. We're also getting really tight quads and really shortened hamstrings. And we go to stand up, and what actually happens is we're pulling onto, like in the joint into the hip. You'll find that your hips will move into like an anterior tilt, as in tilting forward, which is going to create this compression in the lower back. Now, this is a position I see so common, and I'm really familiar with it as I spent 10 years myself in lower back pain. What we want to try to do is over time start to bring our bodies back to alignment, which is starting to find some length into the lower back, and of course bringing the pelvis under the rib cage, which is where it is aligned. Now, if you are experiencing low back pain at the moment, what we want to do is try to find some balance in the body by decompressing any tight layers of fascia. So for a lot of us, if we are not diaphragmatically breathing, again, or if we are patterning a certain way, as in holding a device or sitting in chairs a lot or wearing shoes, we're going to find that we're going to be very tight downstream in our calves and in our feet, and we're going to be holding a lot of tension in these areas, which shows up as adhesions or calcified fascia, very similar to scar tissue, which will grip onto the bone because it's years and years of tight patterning, especially if we also are standing a certain way. If we do this for most of our life, when we're talking to people, we're going to have one collapsed side, and we're going to have more adhesions on one side of the body trying to pull us back to alignment. Now, it's those adhesions, these build-ups of collagen in our fascia, that can be pulling our body in and down. So when we experience back pain, if we can create a bit more flow and work through the adhesions and create a bit more space, it can really help alleviate the pain that we're feeling in our lower back. So what I'm going to share to you is a very simple release that you can do with a roller or a rolled up towel or a yoga block that will help relieve any tension in the calves, especially if we've got any adhesions here, that can start to get a little bit more blood flow and oxygen through the whole body and create less tension in your calves, which would pull the hip joint or the SI joint in and down, which can create that lower back pain. A couple of weeks ago, I was experiencing lower back pain myself, and every morning I was releasing my calves and my feet so that there wasn't any pulling sensation down onto my hips or my lower back. And that, plus a little bit of gentle movement and fascia flows in the morning, really helped what I was experiencing heal a lot quicker than if I wasn't doing anything at all. So we're not going to work with the lower back, we're going to work downstream into the body. I'm going to come onto the roller, and I'm not going to be here for the whole 3 minutes, but I'll demonstrate what to do. I'm going to be placing my calf onto the roller, and you can support yourself with your hand. You will find where the position is. When you search onto the calf, you will find a place where your body kind of screams at you like, oh shit, that is definitely the point where I feel pain. That's what we're looking for, and this is where we're going to stay. So we're going to land on that pain site. That's generally where the adhesions are in our body, or build-ups of collagen. And we're going to stay here for 3 minutes and diaphragmatically breathe. So I'm going to take you through 1 minute, but I would like you to stay for 3. If you've found the pain site and you'd like a little bit more pressure, then you can put your foot over the top. But it's so important that your body stays relaxed, because we don't want our nervous system to be into tension when we're trying to get blood and oxygen down to our calf. So it's really important that your body is soft, relaxed, and at ease. And we move into a diaphragmatic breath. So I invite you to just find that place onto your calf. It could be on the more lateral side of the calf or more medial. And then we're just going to slowly close down the eyes and move into a 6 count exhale and a 4 count inhale breath. So when we diaphragmatic breathe, we are belly breathing, Nothing into the chest or the shoulders. And we are going to stay here for just a minute. But again, when you do this, I would love you to stay for 3 minutes each side so that we can create some space in the calves, which will start to alleviate what we're experiencing upstream. So let's take a few breaths here. We're going to close down the eyes. We're going to inhale for the count of 4. So belly expands. Now as you exhale, squeeze the belly to the spine for the count of 6. So the belly moves towards the spine for the count of 6. Continue with that breath. Inhale through the nose. The belly expands like a balloon. And then exhale through the nose, the belly to spine for the count of 6. So extending your exhale for 2 counts longer than your inhale. I really want you to think about when you're breathing here, what's actually happening with your diaphragm. So every time you inhale, your diaphragm pushes down into your abdomen, your belly expands. But every time you exhale, that diaphragm lifts up underneath your rib cage and we create a lot of space. And there's also a really beautiful feeding and cleaning process here that happens with your cells. Every time you diaphragmatically breathe, not only do you send heat, but you get blood and oxygen to every single cell in the body. So if you're not breathing, the areas such as the calves and the feet can become really frozen. And again, that tension in the fascia will actually pull your body and your joints in and down. And that's where we start to experience pain. So take one more breath here. So in through the nose for the count of 4, the belly expands. And out through the nose for the count of 6, and the belly squeezes to the spine. So you want to spend about 3 minutes on each of your calves. You'll notice that one side will feel a lot tighter than the other. That is due to the patterning in the way that we stand, and of course which direction we have kind of tipped into for however many years we've been standing, talking and posturally aligning ourselves. So when you're working through this one, it's something you can absolutely do every single day. It's a really passive fascia decompression release for the body. And you don't even have to do it on your calves. You can do it on your feet by working onto a lacrosse ball. You could do it on your hamstrings, but it's really important you're looking for like area that is talking to you. So when you put the roller or the object, make sure it's a hard object, something unfriendly onto the body. You want to feel it because that's where the fascia has become really tight and calcified. But that's what we need to clear out so that we're not getting that knock-on effect upstream. Think about if things are really tight down here, that's going to be pulling the body in and down. So the patella is going to be moving out of its space. The hip joint is going to be pulling down, and that's going to play a massive role into your lower back. But even when the body is in pain, and you might be experiencing that acute lower back pain right now, this will really give you a little bit of relief over time. So I would love to hear how that works for you. So please feel free to let me know.